Good afternoon, everyone. Thank you so much for joining us. I'm Erica Hartquist, Public Health Division Communication Officer with the Oregon Health Authority. Today, we are providing our monthly update on COVID-19, as well as RSV and influenza activity in the state of Oregon. And joining us is Dr. Dean Sidelinger, Deputy State Health Officer and State Epidemiologist. We are also joined by 3 local clinicians who will share their experiences and recommendations during this respiratory season. This is an opportunity, we always say this, but it's for members of the media to ask their questions and hear from our experts today. The public is encouraged to ask questions during OHA's Facebook Live events. And we want to remind all of you to please mute your microphone. Please mute your microphone and use the raise your hand function if you'd like to be added to the queue to ask a question today. We are granting permission. Britt is granting permission for all of you to record one by ones. We appreciate your patience. And that is just a friendly reminder, again, to raise your hand if you'd like to ask a question. Okay, let's get things started. Dr. Sidelinger.
Thank you, Erica. Good afternoon. I'm Dr. Dean Sidelinger, Health Officer and State Epidemiologist with the Oregon Health Authority. Thank you for joining us. This is normally the time we give our monthly update on the state of COVID-19 in Oregon. We are still doing that, but we want to do it this time in the context of the greater challenge our state is facing right now. I'm talking about the rapid increase in people, including children, sick with other respiratory viruses, namely respiratory syncytial virus, or RSV, and influenza, and the resulting surge in hospitalizations that is overwhelming our state's healthcare system right now. Here are the 3 most important pieces of information I want to convey today. The situation facing our hospitals is extremely serious. Today, more hospitals are reaching a point of crisis in their adult bed capacity, just as our pediatric hospitals moved to crisis care standards in the past 2 weeks. The combination of surging flu, RSV, and COVID-19 cases is pushing hospitals past their current ICU bed capacity, which never happened during the darkest days of our COVID-19 pandemic in Oregon. OHA and Governor Brown are taking action to aid hospitals in this crisis by giving hospitals needed staffing flexibility and providing emergency short-term resources to enable hospitals to bring more nurses and other staff from out of state. Finally, every one of us can protect ourselves and our families from respiratory viruses and prevent them from spreading to other people as another wave of respiratory diseases sweeps the nation and Oregon. Hospitals are overwhelmed and don't have enough beds to treat everyone in the manner that they're accustomed to. Many more children are being hospitalized with breathing problems than in past seasons, especially children under 2. Now, more adults will be at risk of not getting the hospital care they need. We need to protect our kids, our hospitals, and our exhausted healthcare heroes. Wear a mask when you're in crowded indoor places this winter. To share what's happening in our hospitals, I'm humbled to be joined by 3 people who are experiencing firsthand how patients, their families, and our hospitals have been affected during this crisis. They include Dr. Wendy Hasson, the Medical Director of the Pediatric Intensive Care Unit at Randall Children's Hospital, Dr. Moreno, Chief Medical Officer at Providence St. Vincent Medical Center, who has a background as an emergency department physician, Dr. Matthias Merkel, the Senior Associate Chief Medical Officer at OHSU Health. They will provide brief updates on the types and severity of respiratory illnesses they've seen, how they are responding to the surge, and the biggest challenges they face as this crisis continues. But first, let me give you an overview on what we are facing. It is heartbreaking to have to present this information, knowing the tremendous pain that it represents for my fellow Oregonians, their families that are facing illness right now, as well as the healthcare providers taking care of them at this moment. We saw an almost 5-fold increase in RSV-associated hospitalizations in Oregon's children between October 23rd and November 13th. And while RSV-associated hospitalizations peaked during the week ending November 19th, rates of hospitalization remain higher than during any previously recorded peak. So while the worst of RSV is behind us, many sick children will continue to require specialized care during the weeks to come. Influenza activity in our communities has doubled week over week for 5 consecutive weeks between October 18th and November 28th. Test percent positivity increased from just 1% to 30%. And flu-related hospitalizations have increased rapidly since late October and are affecting people 65 and older the most. During this short period of time, the hospitalization rate in the elderly has increased tenfold. This year's influenza season has begun earlier than it normally does, and we are seeing high levels of influenza nationwide. We will keep monitoring the influenza situation and its effect on hospitalization, but we do expect flu activity to maintain its upward trajectory into the winter, particularly as the holiday season and gathering with loved ones continues. Of course, the COVID-19 pandemic is not over, and we're seeing warning signs that COVID-19 cases are quickly increasing this respiratory season. Both percent positivity and COVID-19 levels in wastewater have risen, signaling increased spread in our communities. And as expected, there has been a corresponding rise in the number of patients with COVID-19 in hospitals, from 235 to 347 during the past month. An increase of 48% ICU hospitalizations have also risen from 27 to 35. That increase is 30%. COVID-19 deaths remain flat over the last few months, but as deaths are a lagging indicator, we may unfortunately see that trend change. So what does this all mean for hospitals the rest of this respiratory season? It means our healthcare system will continue to be under severe strain. The latest statewide forecast from OHSU's modeling team, led by Dr. Peter Graven and published December 2nd, projects that surge in respiratory illnesses will keep intense pressure on Oregon hospitals with a sharp increase in flu cases, superseding a steady decline in RSV cases. The number of people in Oregon hospitalized with COVID-19 is expected to peak at about 408 by Monday of next week, although the OHSU forecast suggests the COVID-19 hospitalization peak could be extended if new virus subvariants turn out to be more transmissible, avoid previous immunity, or cause more severe illness. OHA is working closely with Governor Brown to provide staffing relief to Oregon-strained hospitals. Yesterday, Governor Brown has issued a new executive order that continues and expands her November 13th emergency declaration to provide additional flexibility to Oregon hospitals so there are enough healthcare workers to meet current needs. Hospitals can draw on a pool of medical volunteer nurses and physicians and other critical steps that can be taken to care for patients. OHA has helped hospitals bring additional staff and healthcare providers from out of state to help ease Oregon's hospital capacity issues. We expect more than 100 contract nurses and respiratory therapists to be in place in the next week. And OHA is pursuing up to $25 million in additional state funding for supplemental staffing contracts to help address the critical workforce shortages. OHA is also communicating regularly with our healthcare, public health, laboratory, and emergency preparedness communities through the Health Alert Network, or HAN, to provide updates on the surge response, medical treatment, vaccination and testing supplies, investigative guidelines, clinical recommendations, and prevention and health promotion messages. But we also want everyone to know there are simple steps you can take to slow the transmission of these respiratory viruses. We're all tired of dealing with these respiratory diseases, but we know what works to keep our families and our neighbors safe. Wear a mask when you're in crowded indoor places this winter, and stay up to date on your vaccinations. Masks work, period. During the worst of the COVID-19 pandemic, Oregonians wore masks at higher rates than people did in most other states. Oregon had one of the lowest COVID-19 death rates in the nation. Our hospitals were never overwhelmed, and we saved more than 5,000 lives. For the next several weeks, wear a mask to the grocery store and any other crowded indoor locations. A mask will protect you and your family from getting sick and missing out on the joys of the holiday season. More people wearing masks will slow the spread of these diseases, protect children, and help keep hospital beds available for people who need them. Consider changing or postponing gatherings if your family includes young children, older adults, or individuals with underlying conditions. Stay home and limit contact with others if you're sick. Cover your coughs and sneezes with the inside of your elbow, or do that into a tissue that you throw away. And wash your hands regularly with soap and water or use hand sanitizer. Finally, it's not too late to get your flu shot or your COVID booster. Vaccines help protect you from getting sick and developing a severe case of respiratory disease and spreading that to others. I know these messages are not what anyone wants to hear in the middle of the holiday season for the third time in as many years. But as Oregonians, we've proven we can protect ourselves, our kids, and our hospitals by taking these simple steps. With that, I'd like to pass the microphone over to my healthcare partners for their comments. And first up is Dr. Hasson from Randall Children's Hospital.
Thank you so much for having me. What's going on in the pediatric world is truly historic nationwide and also here in Oregon. We're seeing historically high levels of respiratory viruses, RSV at record high levels. And I'm happy to say that that's finally going down, but it's going down very slowly and is still at extremely high levels. We're seeing just rapidly escalating numbers of influenza admissions, as well as other admissions for COVID-19, rhinovirus and enterovirus. And as a result of this, we are seeing record number of emergency room visits, urgent care visits, hospital admissions, and pediatric ICU admissions. And as a result, all three healthcare systems in the Portland area that care for children have been operating above capacity now for several weeks. And that means that we've had to increase our ER capacity, increase our ICU capacity, and think creatively about how we're taking care of children. And I want to be clear that this really is a first for Oregon, that we have seen this. We have dealt with respiratory surges every single season, every single year. But this operating above capacity really is historic and new. I do want to be reassuring to parents that pediatric providers are extremely comfortable and familiar with managing these respiratory illnesses. RSV, influenza, these are all very familiar diseases that we treat frequently. And children, particularly ones who are previously healthy, can do extremely well if they receive the supportive care that they need in a timely manner, meaning that they receive oxygen therapy, antibiotics, and sometimes even ventilator support. We expect that their outcomes will be good. And so I want to be clear that the crisis that we're dealing with in pediatrics is a crisis of a lack of healthcare personnel, a lack of respiratory therapists, nurses, and support staff. And so that's why it was so important that we declared crisis standards of care in November in order to allow all of the pediatric facilities to provide care as creatively as possible, because we are committed to delivering care to all of the children that need it within Oregon and Southwest Washington in as timely a manner as we're able to. And crisis standards of care allows us to do that. We know that our community partners have really been stretching themselves. I have been impressed time and time again by how amazing the emergency departments have been in these community hospitals. But it's really important that children, particularly very small children or very sick children, receive care at children's hospitals where the staff have received specialized training to care for them. And so we are doing absolutely everything we can to make sure that every child that needs our care gets to us. And sometimes that means that we're being creative. So maybe a child comes to the emergency room instead of directly to a hospital bed, or maybe we're doubling up patients. And so what I want the public to know is that care may look a little bit different, but we are still doing everything we can to provide that care. And so we do ask for grace from the public, as we may not be able to offer the amenities that they're used to, such as private rooms. So your child may have to share a room, your child may have to be seen in the hallway, but the most important thing is that your child receives the medical care that they need when they need it. I do want to focus on what families can do to help protect their own children, as well as the resources of the pediatric community. And so I want to stress that we are seeing rapid numbers of flu cases being admitted to the hospital. And I will say I have admitted many patients over the last 2 weeks with the flu, and I have not admitted a single patient who has received a flu vaccine. Flu vaccines work. They keep kids out of the hospital, and I cannot stress this enough. If you have been on the fence about getting your flu vaccine, now is the time to get one immediately to keep your child out of the hospital. I also want to encourage parents to be really thoughtful about what they're saying yes to right now. Now is not the time to go to crowded indoor places like indoor birthday parties, play places, restaurants, grocery stores. Anything you can do to keep your child out of a crowded indoor area will help protect your child and the resources of the community. I want to encourage parents, particularly of very young babies, to feel empowered to say no to visitors. That can be really hard, but now is the time to say no, thank you. I do not want visitors seeing my young baby. And masking works. So anytime you have to go to an indoor crowded area during this surge, if you and your child can wear a mask, that will also help protect the resources for all children in Oregon. Thank you so much, Dr. Sidelinger.
Thank you, Dr. Hasson, and for that reminder that all of us who are 2 or over should be wearing a mask in indoor public places as we move forward in these next few weeks. I'd now like to turn it over to Dr. Moreno from Providence St. Vincent Medical Center.
Great, thank you for this opportunity, and thanks to the OHA and to the governor for this most recent declaration. Not only does it bring extra people and resources into the system to help us take care of this, I'll echo Dr. Hasson. We haven't seen anything like this before, this unprecedented surge of demand for care, but it also allows us to be as flexible and creative as we can be and how we put our teams together to take care of these patients. I think the other thing the declaration does is that it lets the public know very explicitly how serious this current situation is. I also want to thank all the nurses, the docs, the RTs, the other caregivers in the hospital who've been doing everything that they can to meet this need. I mean, I know the folks in my building, but I know the folks in the other buildings and across some of the calls that the 3 of us on this call have shared across systems. Everybody is doing everything they can to take good care of people. So Dr. Sidelinger and Dr. Hasson set the scene, and this evolved from no longer just being kids to involving adults. And this matches what my ED colleagues are seeing downstairs. RSV in children has now exploded with influenza. And we are also having hospitalized COVID patients at levels that maybe a year and a half ago or 2 years ago, we'd say, wow, we've got a pretty good number of COVID patients in the hospital. That has now become the new baseline in this last little bit. So the hospitals are full, the emergency departments are full, people are boarding or waiting in emergency departments to get admitted upstairs. And inevitably, that means that ED lobbies are crowded. We are experiencing very, very long wait times for the less urgent cases in our emergency department as we prioritize seeing these people by the level of urgency that their complaint requires. EDs are very crowded right now. And across all of our systems, people are waiting hours to be brought back to a care room. So what are we doing, and what are we all doing already? We've already been stretching, being as efficient as we can, maximizing discharge, optimizing our care teams. At my shop, which is the smallest of the 3 pediatric hospitals here in town, we've been trying to do our part to help with the pediatric surge, refocusing some of our adult resources to maximally staff all of our pediatric spaces, rescheduling some pediatric operations and procedures to maximize that staff, and putting some older adult-sized teenagers into adult spaces. And just more generally for this adult surge, we have surge expansion pieces underway to create more capacity here on our campus. So how can folks help who are listening to this, the public that's listening to this? I think the first thing is just understanding and appreciating the situation that now you've heard from one of us. And with my background as an ED physician, I want you to understand what's happening in the EDs right now. Obviously, we want you to come to the emergency department if you really feel you have an emergency. And that's what we're here for. But if you don't feel you have an emergency, please consider other options and venues for care. Reaching out to your PCP, virtual care options, urgent care options. Emergency departments are very, very, very full right now. All of ours are full. The other thing you can do to help is take care of yourself and others. And I know this is not the message we want to hear with the holiday season. And I want to echo Dr. Hasson's plea to get immunized. Get immunized for influenza, get your booster for COVID. It is not too late. It is not too late. Please get immunized. Avoiding crowded indoor places. Again, you're going to hear this from all of us as physicians, how important this is. And don't gather if you're sick, even just a little sick. Really, that protects other people. And then if you are in crowded places, wear a mask. And all of us know masks work. And how do we know this? When we look over these past few years with the very strict masking, we didn't see much influenza in our community. We didn't see much RSV. So masks really work to protect us all against these respiratory illnesses. So thank you so much for this opportunity to speak to the public a little bit and to share this time with you all.
Thank you, Dr. Moreno, and for those messages, reminders about what we can do to stay healthy, and also the locations that we can seek care, that emergency departments are not our only option. With that, I'd like to hand it over to Dr. Merkel from OHSU.
Yeah, thank you, Dr. Sidelinger. Really honored to be here. As Dr. Moreno said, we got to know each other on Zoom meetings over the last couple of years quite well. I really want to call out, similar like what you already heard, OHSU is in a similar situation. We have a large boarding volume of patients in our emergency room. We have reduced our surgical scheduled admissions so that we can take care of the emergencies and urgent care coming through our doors. We have extended into recovery room areas in hallways in the emergency room, our inpatient unit, to kind of really respond to this sudden increase of patient needing our care. And with that, I think it's really, I want to really call out all the healthcare workers who have done an amazing job, their family members, to give us the time to provide the care all of us need at a time. And I think now it's fair to say that most of us either in healthcare have either needed urgent healthcare ourselves or one of our family members. I can tell you from my own experience, just a month ago, my teenage daughter needed to go to the emergency room, and I was sitting there for 12, 13 hours in my own emergency rooms area. And the reason why is because there were several ambulances coming in with children who needed immediate life-saving care. And while as a father, I hated to sit in our waiting room, I understood and I can understand why this is necessary. So I think my ask is really, please understand if you're waiting in line, if you get care in a hallway, if you need to share a room, this is because this makes space for the next patient who may be yourself or your family member. And it's really important that we appreciate that. The important part, what I really think is coming out of the last 3 years, all of us created our playbooks. In 2020, it took us 3 months to get sort of prepared of this unknown what COVID is. And as Dr. Hasson said, the respiratory viruses for the pediatric population, the influenza care, we are very familiar on the pediatric side and on the adult side how to care for them. We just need to make sure that we can stay one step ahead of making the bed available. And what happened in our pediatric ICUs over the last 3 weeks, it was phenomenal to see how our pediatric hospitals leadership and all of the healthcare workers in our pediatric hospital could come together and really function as one big ICU. And we were able to coordinate this among us so that we can place the next patient and Randall's Children's Hospital, Dernbecker's Children's Hospital, and the St. Louis Pediatric ICU really on speed dial with each other through the Oregon Medical Coordination Center, which we, with the help of Oregon Health Authority, kind of started in August last year, and we're just able now to really put it on a 24/7 24/7 operation. And like, I think this is really important to understand that we function across the entire state, all the bigger health systems in support of the smaller community hospitals, so that patients who end up in small hospitals emergency room have a voice, and that we collectively find out where in our state can we place that patient needing care right now. What can you do? Most of all, understand that this has been a long stretch for all of us in healthcare. We want to take care of you. Sometimes we need to do it in a location which we would have never kind of considered taking care of you, but we will provide you the best possible care we can. And we partnering, collaborating together so that you or your loved one can really get the care they need. If you get a call from any of us that your surgery needs to be canceled, please understand we're doing this so that the emergency coming into our doors can be cared for when they need it most. And nobody wants to get this phone call, and it's really hard for all of us. And like, when you need to schedule something, it just takes a little bit longer. Again, I want to really emphasize, wear a mask if you go in crowded indoor spaces. Do your own risk assessment. If you or your loved ones have a vulnerable patient or person at home who are really likely to not do well with an infection right now, protect them and yourself from the next infection. Wash your hands as often as you can, wear a mask, and foremost, together we will get through that.
Thank you, Dr. Merkel, again for those reminders of what we can all do to stay healthy, and also that reminder that our healthcare heroes who are continuing to provide the care to all of us during this time are impacted by illnesses and caregiving responsibilities that go up during this respiratory surge. So we're all in this together. With that, Erica, I think I'll turn it over to you to begin our questioning.
Great, thank you, Dr. Dean Sidelinger. Our first question comes from Gary Warner with EO Media. Go ahead, Gary.
Hi, Dr. Sidelinger and everybody. Thanks for taking time on this today. Since you're doing these briefings about once a month, that would mean in a month from now, we'd have a new governor and a new administration. I wondered about the continuity of policy that's going to be going on. Dr. Sidelinger, will you be staying on through the changeover in administrations? Who's going to be in charge of OHA after Pat steps down the day the governor comes in, or the day the new governor comes in? Like who's the quarterback, as it were, on a policy level for this state going through to the next meeting that we have like this?
Thank you, Gary, for that series of questions. I'll start with myself. I can speak for myself that I plan to stay in my role and support our public health team across our state and local, and working with our tribal and federal public health partners as we implement programs and policies to keep Oregonians healthy and safe. I don't have any inside knowledge to share with you on the new director of the Oregon Health Authority, but can assure you that Governor Kotek and her transition team have been meeting regularly across OHA and other state agencies to ensure a continuity of care, particularly as we face this crisis. So I would expect us to be able to continue our strong partnerships with our healthcare partners, our local public health partners, as we respond to this triple threat of respiratory diseases facing us, and that you won't see significant changes in that response or cadence as we go into January.
Thank you.
Thank you for that question. Our next question comes from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hi, thanks for taking my question. So a thing that I'm a little bit confused about is, so over the last few years, the messaging has been that masking works, and that was part of the rationale for putting in place mask mandates, to my understanding, essentially to, at least in part, prevent the kind of what we're seeing in hospitals right now. So is a mask mandate still a viable tool for OHA or the state to put in place? If it is, given the descriptions we've heard today about the situation, why hasn't it been put in place? And what are the factors that will determine whether it will be put in place, if that's still a variable?
Thanks, Fedor, for those questions. Yeah, I think we can definitively, myself, my healthcare partners who are on the phone today can say that masks work. And with throughout this pandemic, we had messaging around masking. We had requirements in masking for a time period. And as COVID-19 overall had gone down and people had multiple choices, multiple times and opportunities to get vaccinated, we took that requirement in place and continued to message that those individuals who are at higher risk for severe disease or who care for someone at higher risk, and that includes parents of younger children under 2, should consider continuing to wear a mask. That recommendation continues, and we haven't moved into a requirement phase because we know that Oregonians have stepped up in the past. Oregonians wore masks and continue to wear masks at higher levels than many other states, and those decisions have saved lives. So I anticipate that as we share these stories of what's happening in our healthcare systems, as we share these stories about the tremendous impact that children and their families are having right now, that Oregonians will again choose to wear a mask, and we won't have to resort to a mask mandate. I don't have specific criteria or data points out there. I really am pleading with individuals to wear a mask. And like I said, Oregonians have changed their behavior in the past, have stepped up and put on masks even after they've taken them off to protect themselves, loved ones, the children in their lives, and their neighbors. And so I'm hoping that they will do that again, particularly as we move into a holiday season.
Thank you. If I could follow up, so there's been some of that messaging coming from health officials for several weeks, and yet with every week, the news appears to be the situation appears to be gradually more and more dire. I mean, how confident are you that the messaging, recommending, and pleading will succeed?
Like I said, I think that this is starting to have an impact and will have an impact in the coming weeks. Things will get worse before they get better. We know that based on when people were exposed, when they get sick, and what we're seeing in the trends. But we know that if more individuals are wearing a mask in crowded indoor places, are reconsidering their activities, maybe postponing plans or changing plans around, and they're staying home when they're sick, that we can reduce the number of cases that are coming to hospitals and help to lessen the crisis that our hospitals are facing. We are still going to need additional staffing to care for the patients. You're still going to need to be patient if you're seeking care and you need care. Our healthcare providers are going to continue to provide you that care, be it in a hallway, be it in a room with another patient. But if we all take those steps to wear masks and consider changing our plans, it is going to blunt it, but it won't prevent the crisis from happening.
Thank you for those questions, Fedor. Our next question comes from OPB, April with OPB. Go ahead, April.
Hi, yeah, I was just looking at pediatric ICU beds, and for the last, week or so, they've been kind of hovering around like 4 or 5, but yesterday they were at 12 and today they're at 15. So is that an indicator that we are getting more pediatric ICU beds available, or did we just open up some new ones? Is this number inaccurate? Did it capture maybe a time when it wasn't very busy? Like, could you help me understand this number?
I'll start with some overall messages and see if some of my colleagues want to add on. Those numbers of beds are not a fixed number. And so with the governor's initial emergency order around pediatric respiratory diseases, our hospitals were offered some flexibility to help care for more patients, and that included more patients in ICU. So there were more slots, more beds available at that time to care for the onslaught of patients that have come in. So that number, of beds that were theoretically available, whether they had patients in them or not, did increase. We are also seeing indications and hopeful indications that our RSV numbers that have been overwhelmingly impacting children are starting to level off and have started to come down. While influenza is coming up, that's not impacting kids as severely. So I think it's a combination of slightly less kids who are sick right now, slightly more beds available, but certainly not out of a crisis mode. And certainly our pediatric healthcare providers are doing the heroic effort to continue to care for more kids than they have with respiratory disease in the last few years. I'll pause and see.
Thank you.
I can add maybe a little bit context to that. When you look at these bed tracking tools and all hospitals came together and we have sort of a real-time bed tracking tool, it shows you if a physical bed is currently occupied. It doesn't give you the full dimension of like what's coming in, what's going out, do we already sending for it? But like I agree with your question, like I think the crisis care standard allowed our pediatric hospitals to increase their ICU footprint way above what we normally even kind of be able to staff. And now it's sort of like we holding up with the demand around that, and it might kind of, it's going a little bit up and down. What we definitely see in our pediatric hospital, like because of this demand, we have a fair amount of patients, children sitting in our acute care area getting care, which like we often would still have kept in the ICU. We just like had to make adjustments to kind of take care for the next sicker patients while still continuing the care for that. So I think this is a good sign. I would defer to Dr. Hasson, who is much more the pediatric expert, what this means, but I think in some regard, it is a positive sign that we can keep up with the demand on pediatric ICU beds our state may need right now.
Yes, I agree with everything that's been said. I think that we are seeing just a very, very brief reprieve as the RSV number goes from being at an extreme high to just slightly less than an extreme high. And we're starting to see flu cases increase. And so I think that over the last day or so, while we may have had a brief reprieve, I don't anticipate that it's likely to last. And I've been preparing my staff that we should expect to be operating above capacity for at least the next month or so. I would be happy to be wrong, but that's what we're preparing for. And I'd also like to point out that one of the things that's different between pediatrics and adults is that we're lucky that kids tend to turn around very quickly, particularly babies with RSV. And so the length of stay for these children is much, much shorter than a critically ill adult. And so if you follow that dashboard, you'll see that the fluctuations can be extreme within, sometimes 6 to 8 beds within a couple hour period, because we're getting kids in and out very, very quickly.
Great, thank you all for your answers and for those thoughtful questions. Our next inquiry, our next question comes from Christina from K2. Go ahead, Christina.
Hi, thank you. Yes, I have a couple questions. First, I was wondering how many hospitals in Oregon, you mentioned it's the crisis standards of care have extended from pediatric to adults. How many hospitals in Oregon right now have those crisis standards of care? And are we at the point of rationing life-saving care?
Thank you for that question. Right now, our 3 pediatric providers in the Portland metro area who provide the only specialized PICU and pediatric care across the state have officially asked for and are using the crisis standards of care to make staffing decisions. Other hospitals are certainly facing a crisis and have been doing additional things to increase staffing, but none, to my knowledge, have officially asked to enter into crisis standards of care. They're doing other things to increase staff resources, bed availability, and other creative things, such as you heard from Dr. Moreno, I believe, canceling some urgent but scheduled surgeries that may free up a bed. So as far as right now, it's our 3 pediatric providers who have officially asked to enter crisis standards of care and are using that additional flexibility in their care. Not sure if anyone wants to add to that.
The second part of the question on whether or not we are entering a point of rationing life-saving care.
I think what you heard is that some routine care, some scheduled care, it's not really routine, this is urgently needed care that can be scheduled, is being postponed. This means people may stay in pain longer because they need, an orthopedic procedure such as a hip replacement. They may be delaying care for their cancer with removal of tumor or staging of their disease. So, this is care that's being delayed, but our healthcare partners are doing their best to provide the high quality care to everyone that shows up. Again, it may look different. You may be waiting longer. You may get that care in the hallway. You may get admitted to a room that you share with other patients. So the care is looking differently. And that is the sense of how our partners are utilizing the resources to provide that care for everyone who shows up. And right now, with the flexibility that's being offered, that care is there. But if patient numbers continue, even more difficult decisions will have to be made by our healthcare partners.
And then one quick follow-up question: with the 25 million that's been given to hospitals as part of this Brown's executive order, is any of that going to support staff that has been working through this crisis and previous crises at the hospital? Any incentives for those, or is it all going to contract workers and outside of the state workers?
I can't answer on behalf of our healthcare system partners, and some of them may want to add, but OHA, in conjunction with our healthcare partners, are working to increase the number of employees, traveling employees from out of state, who can help to augment the current healthcare workforce that they have. Our healthcare providers have existing contracts and relationships that they use, and OHA is also leveraging some of the resources that we have to bring additional staff. As far as utilizing resources for existing staff, I'll defer if any of my healthcare partners want to talk about that.
But wouldn't that be an OHA and something that you guys are looking at? If you're distributing the money to hospitals, wouldn't you be looking at where that money is going and auditing where that money is going?
The emergency order expansion by the governor was signed yesterday. And so those $25 million are being used to support additional resources and staff to be deployed across these systems to help augment the staffing that's currently caring for patients right now. There's nothing to audit on a program that was just announced yesterday.
Okay, but as far as parameters go, are there any parameters that require this to go to existing staff in one way or another, whether it be support for those staff as far as answering phone calls and things like that? Or extra incentives for staff to come in on those days?
This is designed to be used to pay for additional staffing that can help care for patients across these settings. That could be nurses, respiratory therapists, physicians, and other staff that are needed to provide critically needed care at this time. So depending on the need in the facility, depending on the type of facility, be it a hospital, a skilled nursing facility, those staff may look different.
Great. And I want to get to the other media partners that we have in this call. If you have a follow-up, Christina, feel free to raise your hand again. Now it is Lisa Balick with COIN. Go ahead, Lisa.
Yes, thank you. Question: as far as the Oregon Nurses Association and some hospitals have asked for the National Guard to be called in once again to help out in the hospitals, at what point will that happen?
Thank you for that question. I want to thank our National Guard partners for the tremendous work that they did in our response earlier on in the pandemic. They were an incredible staffing resource for our mass vaccination clinics in helping to staff that. And they were an incredible resource to augment our healthcare providers in hospital settings and other healthcare settings where our National Guard members served a critical need. Right now, what we're hearing primarily from our hospital and healthcare partners is the need for professional medical staff that can help care for the patients that are showing up every hour and every day in emergency departments and needing admission. And that's where we can bring those staff on much quicker and more efficiently through our contracting mechanisms, through bringing on some of our volunteer providers and helping to facilitate bringing in contractors from out of state. Certainly, I think that will continue to be an option and may be needed down in the future. But right now, healthcare staffing can be more efficiently and quickly brought up through our existing mechanisms, and these resources, the $25 million in additional resources, can help to do that over the next couple of weeks, when we expect to have more than 250 additional healthcare personnel who can help augment the tremendous work that staff are currently doing in our hospitals across the state.
A follow-up on that about the National Guard, though. If you talk to nurses, they say they would love to have the National Guard back because it will often free up nurses that are already in the hospital to assist with care, as opposed to answering phones, transporting patients, doing a lot of the things that the National Guard did that freed up the nurses that are already here. So why not bring them in? What's the hesitancy?
Let me say that there's a lot involved in bringing up the National Guard. Those National Guard members, most of them have full-time jobs, and so often we're pulling them away from those other jobs which are critically needed during this time. There's also the need to do training and orientation and things so they can help out in these situations. Right now, the critical need is these professional and trained and licensed healthcare providers, which can be done through these mechanisms with contracts with some of our out-of-state providers and through our volunteer mechanisms that we have in place. and the executive order that was issued for our pediatric respiratory surge that was expanded across, adult respiratory surge just yesterday by Governor Brown provides OHA and our healthcare partners with flexibility to bring more of them up quickly to meet the need that's right in front of us. And the Oregon Guard right now, we won't meet that need immediately, but certainly we will have all tools in our toolbox available should we need them in the future.
Thank you for those questions, Lisa. We have a follow-up question now from Gary Warner with EO Media. Go ahead, Gary.
There we go. I'd like to pull out just the COVID portion. Dr. Sidelinger, at the end of this month, will be hitting the 3-year anniversary of COVID in our lives. Can you give us sort of a snapshot of where the state is right now in terms of COVID? You talked about the 3 waves that are happening here with RSV and then the flu and then the COVID. Pull out the COVID and what that's looking like down the line. The fact that we're into 2 new subvariants of the BA.5, I guess, as the dominant variant is, what is the impact on the state right now? And are we still in that sort of Omicron spin around where we're having these increasingly contagious variants, but we're not seeing higher virulence?
Thank you for multiple questions. I'll try and get to all of them. No worries. I think, COVID-19, while all of us would like to put it behind us, still does exist. The Omicron variants, including the new, the BQ1 and BQ11, are incredibly contagious and spread very easily from person to person. We know that when that happens, we see more people get sick. And with that, we see more people needing hospitalization. And we've certainly seen that increase in COVID-19 hospitalizations in the previous weeks. And that's on top of a surging influenza or flu hospitalizations and RSV hospitalizations that we're seeing primarily in children and our oldest Oregonians. I want to emphasize, though, that we have additional tools. While our COVID-19 vaccinations and boosters aren't 100% effective at preventing people from getting sick, they do help prevent people from getting sick, but they're really good at keeping people out of the hospital. And that's especially true for older Oregonians who've been more severely impacted by COVID-19 and those with underlying conditions. And that's why we continue to emphasize that people should be up to date with their COVID-19 booster, including receiving the most recent bivalent booster to help keep them safe in case they do get sick. The fact is that with very contagious variants circulating, more of us are getting sick. I bet there's not a single person on this media availability that hasn't either been sick in the last couple of months or had a close family member or household member or friend who's gotten sick. These diseases can spread fairly rapidly, even if we're vaccinated. And once we've recovered, we're not immune from getting the next variant. So, COVID-19 is not behind us. We have those tools, and I hope if you're not boosted with a bivalent booster, you will consider this your chance to go out and get your flu shot as well if you haven't gotten it. These will help keep you out of the hospital, even if they don't prevent you completely from getting sick. But immediately, if you're out and you're in indoor public places, wearing that mask will keep you protected. If you're exposed to someone with flu, RSV, or COVID-19, that mask is going to keep you safe. So that's a step we can all take to try and stay healthy as we move into the next couple of weeks. Getting our vaccinations will help protect us as we move into the holidays and gatherings that will happen at the end of the year. And again, that mask will work against all of these infections, not just COVID-19. So that's my summary of where we are with COVID-19 and how that's playing out with our current flu and RSV cases.
Thank you very much, Dean. Appreciate it.
Thank you, Gary, and thank you, Dr. Sidelinger. Our next question is a follow-up from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Thank you. So this is a question, Ken, for Doctors Hasson, Moreno, and Merkel. So do you believe that a theoretical mask mandate would theoretically help reduce the burden on your hospitals? Have your hospitals asked OHA to put in place a mandate? Why or why not? And what was the response?
Yeah, Dr. Merkel from OHSU. I'm happy to take this on. We have not asked for a mask mandate, but like as we're doing here, I would really strongly encourage every individual to decide when it is appropriate for them to wear a mask, do the hand washing, and do the protective measures for themselves, for their family member, and our community. In addition to this respiratory virus season coming to both the pediatric and the adult hospital part, you have to keep in mind everything else, all the other emergencies we treat year round, the trauma care, the heart attacks, the strokes, the cancer care, they continue, and we need to we need to continue to provide care for them. We need to continue to do our time-sensitive surgery. So yes, every single patient who doesn't need to end up in a hospital is a good one. So that's why the recommendation I would give is like definitely wear a mask if you go in public places, definitely get all your vaccines to really minimize the risk that you are the next patient in one of our totally full emergency rooms waiting for the next ICU bed to be made available for you.
Can you please just...
I'd like to...
Sorry.
I'd like to chime in specifically for pediatric patients. While we are talking about people wearing masks to protect themselves, it really does also protect the community and particularly children. When you look at RSV, the vast number of the children who are hospitalized in the ICU and requiring a ventilator are children under 2 years of age who just developmentally cannot make the choice to wear a mask and protect themselves. And some parents just can't leave their kids at home. These kids still have to go to daycare so their parents can work. They still have to take their kids to the grocery store in order to supply their families with groceries. And so I plead that you wear a mask, not just to protect yourself, but also to protect these vulnerable children who simply can't protect themselves.
I think all of us who are physicians are going to agree on this messaging. Masking makes sense. Please mask. It's a fairly simple message.
Sort of from a logical standpoint, it's unclear what is the logical reason that in this situation the healthcare providers in the state are not proposing a mandate when in past years, when circumstances were even less historic, there was a mandate. I'm just trying to understand what is the difference now that is not something that you are advocating for if it works and it has worked in the past and it has been advocated for the past. What's different now?
Fedor, this is Dean. Let me weigh in here because we've talked extensively with our healthcare partners through the ONCC and other venues about how can we best support hospitals and the individuals who need care and the healthcare providers who are working tirelessly to provide that care. And having individuals wear a mask in indoor public places is an important part of that. The piece that's going to help is people wearing the mask in indoor public places, protecting those children under 2 who can't wear a mask, protecting those who are most vulnerable, and protecting themselves. A requirement in and of itself doesn't do that. But I think that's why you've heard a strong message from our 3 healthcare providers who are here right now advocating for wearing a mask. You saw a statement come out across the medical leaders of our 3 pediatric healthcare systems in the Portland metro area asking people to wear a mask. And saw an op-ed just this week from the chief of pediatrics at Dornbecker Children's Hospital, Dr. Dana Brainer, and the incoming, the president-elect of the American Academy of Pediatrics, Dr. Ben Hoffman, talking about wearing a mask. So, the mask mandate in and of itself doesn't help. It's individuals choosing to wear that mask. And I think that's why we're trying to articulate to you the incredible kind of burden of care that's showing up in our hospitals right now, the impact on children that we haven't seen in the last couple of years from COVID, that we're seeing from RSV and now from flu that's happening, so that individuals will choose to put that mask on in the short term, in the coming weeks, to protect themselves, families, and the children that they return home to.
Thank you for those follow-ups, Fedor. Okay, we're going to go now to a follow-up inquiry, a question from Christina, again from K2. Go ahead, Christina.
Thank you so much. Yeah, I'm going to go back to my previous question and my colleague's question because I don't feel like either were fully answered. We've talked a lot about supporting hospital staff. Again, there has been no talk about supporting nurses. This is just as much, from what I understand, a staffing issue as it is a healthcare crisis. What is being done to make sure we're not losing more nurses, we're not losing more staff? Why are we not sending in the National Guard if we did so during COVID? And you're saying this is a worse situation than COVID?
Thank you for that question. Like I said, right now, what we need is, more licensed and trained individuals to provide the immediate care that's needed. Our healthcare partners have done an amazing job and utilized the tools under the executive order to care for pediatric patients and now for adults to do staffing in a more creative way, to move people around. And that, again, may mean physically providing care in different locations, doubling up in rooms, and that staff may be caring for more patients during this crisis time. Bringing in additional trained individuals who are licensed and can provide care immediately is also important. Our healthcare partners have used their contracts and registries to do that. Our OHA resources have done that and are expanding to do that even more, to provide additional professionally trained licensed staff that are needed right now. I do want to circle back to your previous question about crisis standards of care. I said that our three pediatric healthcare systems were the only three that had done that. I was reminded that Curry General Hospital has also asked for that as they attempt to do staffing and care for the patients that are showing up for care in Curry County.
And
I'd like to take a moment to
I just don't think that question was answered, because the National Guard issue, when nurses are asking for National Guard to come in, but we're saying we're not going to send National Guard in because they're not specialized. And again, that question of how many of these resources are going to make sure that we're not losing more nurses, that we're not losing more staff because they're getting overloaded and they're not getting incentives, but we're paying all these contractors.
Before I turn it over to Dr. Hasson, I'll answer that. I think, right now we know that those National Guard members who are licensed and able to provide this care are often pulled from other jobs where they're currently providing this care. So that is not a short-term solution to the healthcare staffing needs that are right here in front of us. And Oregon is not alone in this crisis in care from our nurses, our physicians, and our respiratory therapists. All states, hospitals across all 50 states, the District of Columbia, and our territories have been providing care at almost nonstop level for almost 3 years. This is COVID care and the next wave that came in, often unexpectedly, the ongoing care that was needed from people who had a heart attack, who needed care after a motor vehicle accident, for the routine childhood accidents that happen that those children and their families need care for. That's happened in Oregon, that's happened in other states, and healthcare providers are tired. And so the workforce has been losing some members, and that's not a unique situation to Oregon. And Oregon is currently, fighting for the same resources with other states that are fighting. So, I wish I could say, that we could have planned our way out of this, but we couldn't. These are unprecedented times across not just Oregon, but other states, with 3, respiratory pathogens hitting at the same time and needing the same resources. So with that, I'll see if Dr. Hasson still had something to add.
Yes, I just wanted to echo what Dr. Sidelinger is saying, particularly, and I can only speak to the pediatric realm, but pediatrics is a highly specialized skill. So our nurses, respiratory therapists, physicians are all trained for many, many years to take care of children safely. And bringing in people who do not have specialty in treating pediatrics will be very minimally helpful. What we really need is exactly what Dr. Sidelinger is saying, which is licensed, trained, experienced nurses and respiratory therapists who can jump right in to be able to safely take care of these patients. And what we've been focusing on is not just creative solutions, but also safe solutions. And getting in the staff that have the experience and the licensure that will allow them to safely take care of pediatric patients is very important. And you're speaking to a nursing burnout, and believe me, nobody is more concerned with burning out our nurses than I am. I very much worry about my nursing staff. They're working double shifts, they're picking up extra shifts because we are committed to providing care to every child in Oregon. And so there is moral injury. And so what you can do as the public to prevent that moral injury is show the healthcare community your support by doing these measures that we talk about. Wearing your mask out in public so that when your nurse is out there in the grocery store, they see that you're masking. But most importantly, these nurses need time off. And the only way to give them time off and give them a rest in between shifts is to bring in licensed professionals who can take over their shifts for them. If we bring in the National Guard, they would be acting as support staff, which means that the nurses would have to work the exact same shifts that they were already planned to work. They need a day off, and the only way to do that is to bring in another nurse who has equal skills and can give them that day off.
So much for all of those great questions, everyone. We are at 1 o'clock, so that appears to be our last question. And just so that all of our media colleagues are aware, we are going to be doing an after action press release with a link, the YouTube link of this media availability on it, so that you can pull video clips should you need them, and also more information, including, I think we usually also include the talking points as well. So with that, I'll toss it to Dr. Sidelinger. Thank you.
Thank you, Erica. And I want to thank my healthcare partners who joined me today and took time out from what it has been an incredibly busy time during an incredibly busy couple of years. Oregonians are so lucky to have the dedicated professionals available to take care of them when they need them, even at this time when systems are very stressed. For our media partners, thank you for helping us to get the word out about what people can do. And I just want to remind people that right now, take some simple steps to help protect yourself. Wear a mask in indoor crowded places. That'll protect you, the loved ones, including the children you return home to. If you're sick, stay home and don't go out, even if it means missing that important holiday or family gathering. That will be there later, and you don't want to risk exposing others. Washing your hands can also help, but wearing a mask when you're in indoor places, being up to date on your vaccines are some of the most important steps you can all take right now to help our healthcare partners continue to provide the care that all of us deserve when we show up, and to help protect the children who are being impacted right now at levels that we haven't seen in years.